All right. Thank you all so much for coming tonight and welcome. We are so excited for you all to be here. I am Britt. I've been a nurse for 8 years and I am now the community manager here at Trusted. And for those of you all who are new to Trusted or our platform, Trusted is not only helps travel nurses find jobs that they love, but we also host virtual events on topics like this, nursing in the wild, career advancement, mental wellness, and a myriad of other things. We also support our community on and off the clock with our blog articles, our in app forums, as well as our exclusive benefits and social platforms. So if you're looking for resources or anything like that, we've got you covered. Today, I am super excited as it is Women's History Month, and we have partnered with some amazing women from the Wilderness Medical Society to provide this Women in the Wild event. So we want to thank the WMS for being such a great resource of education, community, and adventure. And I'm going to play a short little video for those of you unfamiliar with the WMS to give a bit more insight. And I'll also link their website if you guys are interested. So 1 second. I'm going to get it together.
We believe the wild keeps us alive. We stand for kindness, service, inclusivity, education, and nature. We elevate others as we climb. We see the need and fill the gap. We look to uproot barriers, not trees. We seek knowledge and pay it forward. We find our way in the wild. We are the Wilderness Medical Society, a community of medical professionals devoted to facilitating high-quality care in the outdoors. Our global membership and world-renowned experts affirm our collective authority to set clinical standards and disseminate the most comprehensive array of wilderness medicine knowledge. Our innovative programs, publications, research, and certifications equip you with the tools to practice in any environment, on or off the planet. Healthy lives are nurtured in wild places. Join us on the adventure and truly come alive.
Amazing, amazing. Every time it gets me so excited. It makes me want to go adventure every time I see this. Kelly, if you want to get back to the slides, we can segue into this amazing event that we have and our amazing hosts. I'm so excited. Awesome, awesome. So without further ado, I'll get into the housekeeping in the next slide, and then I'll turn it over to our great hosts because I know you guys did not come to see me talk. Thanks. So just a little bit of housekeeping. I know some of you all, this platform is new for some people, so I like to just call out what's over here so you guys can kind of toggle back and forth during the presentation if need be. But we have a Q&A section, so we will pause for questions and I'll float them to our hosts and make sure that everyone gets answered. So if you will just put those down into the Q&A portion there, and then we also have an upvote. So if you really like a question that someone else has asked and you actually really want it to be answered, you can just upvote it and I'll make sure that I get to that one. As well as if you are having any audio or visual troubles, what we try to suggest is going out of the event, testing your audio and visual using Google Chrome, as well as using a laptop is preferable just because sometimes things get a little bit wonky with the phones. But those options, and then if none of those work, there's either you can DM me, I'll be manning my chat the entire time, or there's also a help function there, and people are standing by to help you if neither of those solutions work for you all. But we're here to listen and learn and connect and get inspired to empower ourselves to stay healthy outdoors. So without further ado, our wonderful hosts, Kelly and Christanne, are here to take it over.
Yay! Thank you. Real quick, we'll just do a couple introductions. I'm Kelly. I'm a nurse practitioner. I work at Stanford. I'm the lead APP for Express Care, which is basically their answer to an urgent care. I'm also a volunteer firefighter and EMT in my community. And last year I became a fellow of the Academy of Wilderness Medicine, which was a really nice, it was a nice COVID project to work on to get us off the COVID doldrums. It was really nice to work on that. When it comes to the outdoors, backpacking is my thing. That's definitely the thing I do most often. That said, I love to travel. I'm training for a century right now, so I like to ride my bike. I'll do canyoneering when I can. I'm usually up for just about anything. And just because they wanted us to put in some like little secret something about ourselves, I threw in that gummy peach rings are like the best when you're getting real tired and hot and don't think you have anything left in you. A little hit of gummy peach ring totally does the trick. So there's that.
Hi, everyone. I'm Christanne Coffey. Thanks for having me today. I'm an emergency physician at UC San Diego, and I'm the director of our Wilderness Medicine Fellowship Program. So love teaching wilderness medicine and really am passionate about this subject we're talking with you today. I also spend time with within the Wilderness Medical Society, chairing the Diploma in Diving and Marine Medicine, and I'm the medical director for the San Diego Mountain Rescue Team. So we were asked to say what we love doing. Pretty much all of the things I love are related to the ocean, which is why I'm very happy to be living in San Diego. And I have two little ones, a 2-year-old and a 4-year-old, and you'll see a little picture of them later on in the presentation. We were asked to say a fun fact. Hold my breath underwater for 8 minutes, but I was able to do that once before in a breath hold kind of diving exercise, which was fun, and just thought it would be fun to share.
All right. So before everybody joined this, we did a very unscientific survey of who was participating today, just to get an idea of who was here and what your guys' level of experience are, and maybe some of the struggles that you may have encountered going out in the wilderness. One of the first things we asked was just basically what was your level of outdoor engagement. Turns out most of you guys are really quite comfortable out in the wilderness. 65% of you said that you were comfortable spending nights out away from plumbing and electricity. About a few of you said, I like to have a toilet nearby. Another about the same amount said, I'm okay during the day, but I really like to sleep in my own bed. And there was just a couple of you guys that said, I just like to stay inside. So quite a bit of a spread, although I would say not surprisingly, most of you enjoy the outdoors and feel pretty comfortable out there. We asked another question, just we're kind of curious if how many people had run into problems in the outdoors where things like pooping or peeing or periods had really prevented them from engaging things that they might have otherwise been interested in. And these are just raw numbers. So, almost over 20 women said, or actually, if you add them all up, because it all got conglomerated, several people said multiple things were getting in their way. But there were 40 some people that said, having my period really kind of, I've not done something because my period got in the way. Pooping and peeing was also a barrier for some people. And also pregnancy and breastfeeding, less so, but also a bit of a barrier. So we're going to talk about that today. This agenda, when we were advertising it, we talked about, I think when we advertised it as 6 different things. And that's partly because I can't count because I forgot to add the P for physiology. Then I got to 7 Ps. And then one of our Women in Wilderness Medicine committee members reached out to me on the side, and she'd seen a version of this talk before. And she said, would you guys consider adding another P? And so now we're up to 8. And that last P is prejudice. And so that's what we're going to go ahead and start with to get going. I really thought this was a really important thing to bring up. In this lecture, a lot of this is driven, there's a tremendous amount of bias basically in the outdoors. And it manifests itself in a lot of ways. There's some evidence that when it comes to leadership in the outdoors, women really kind of struggle with a couple of different things. If they present themselves and show their leadership in a more feminine way, which I sort of interpret as a little bit more softer and gentler, many people interpret that as not being as confident in the outdoors, as competent at doing some of these things. On the flip side, when a woman presents herself in a more masculine way and has a more masculine leadership style, that's very off-putting to a lot of people. So women are a little bit in a bit of a disadvantage there. As far as safety goes, this is totally anecdotal. I don't know that anybody's done any studies on this, but I know in part of my research, I've been really plugged into social media, a lot of message boards, particularly on Facebook, that cater to a lot of people who are new to this, to being outdoors. And definitely, anecdotally, disproportionately, lots of women come to the group and say, hey, what do I do to reassure my family or my friends that I'm going to be safe outside? And the safety concerns, run the gamut. It could be wildlife, it could be, other, creepy dudes. But I see that question posed quite a bit with women and less so with men. And I think that unfortunately sends a bit of a message that the wilderness may not be as safe for women as it is for men. And there may be a bit of a danger out there. Which I think, if you ask around, is really not a sort of a warranted worry. There's a lot of there's been some issues with gear in the past. It used to be not that long ago you couldn't find women-specific gear, and then there was a period of time what we called the shrink it and peek it phase, where when they decided, oh yeah, we're going to market it to women, we would literally shrink it, put it in a pretty color, and say, hey, it works, right? And women were like, no, not really. And so that's come a long way and is getting better, but that's been a setback. And then finally, when it comes to actual research, when we talk about biomedical research, women are extremely underrepresented in this area. And this is due to a lot of things. Back in the early 70s, there were some studies that unfortunately led to birth defects in some children. Which led to them strongly encouraging women of childbearing age not to be involved in medical studies because they were concerned that there may be some risk of harm. A lot of researchers were really concerned about using women because of their hormonal fluctuations, and they felt that that might make it much more difficult to interpret data, so they would just leave women out. And it wasn't really until 2016 that the NIH actually put a policy in and said, hey, if you're going to apply for research funds, you have to include sex as a variable in your studies. And only if you don't do it, you have to have a really, really good reason for that. So like only 6 years ago was it sort of a mandate. So it's kind of a bummer for right now. We don't have maybe as much data as we'd like to know. That said, if you're interested in research, there's a lot of room for learning in this category. So what do we know physiologically? It should come as no surprise that men and women are different. And I'm going to apologize right now. I use sort of gender terms, women and men, fairly interchangeably with sex terms, so male and female. And that's just the way I'm going to talk about it. I apologize. Just know that when I'm talking men and women, I am talking more sort of male-female differences. But women, when compared to men, do have a lower VO2 max. You might remember that this is basically a measure of how efficient our bodies are at using oxygen. And the more efficient we are at using oxygen, the more energy we can produce, and then that can lead to better performance. And so we can train that up quite a bit, and there's a lot of variability within the sexes. But on the whole, women do have a lower VO2 max. And that's because we have a lower hemoglobin. We don't have as much cardiac output because we've got smaller hearts. And this is going to lead to some exercise differences. One thing, women, thanks to hormones, we have proportionally more fat on our bodies than muscles. This actually is an advantage in some settings. Like when you're in the moderate cold, this means that we retain heat a little bit better, but it also means we have less shivering muscles, and we might struggle a little bit more in the extremes. We do have a lower basal sweat weight than men. So that means especially in like moderate climates, like humid climates, we can adapt to the heat a little bit better. We're going to have less dehydration. That said, in more sort of arid environments that are really hot, we have a little bit less evaporative cooling than men do, so we may struggle a little bit when it comes to acclimatizing in those conditions. And then there's our response to altitude. There's actually a fair amount of data in this area, and more coming down the pike. Women do get more swelling, they get more edema than men in these settings. We do see some what we think are probably hormonally mediated changes. We actually have an increased respiratory rate. We have less of what we call periodic breathing, or these sort of apneic episodes, than men do, which you might think, if you know a little bit about altitude medicine, that increased respiratory rate would lead to lower rates of acute mountain sickness. But it actually doesn't. We have sort of the same rate of altitude illness as men do. So just kind of interesting. Okay, now getting to the nitty gritties, some of the mechanics when we go out in the wild. This is my personal, these few things are my personal interest. So I'm going to try not to talk about them too much. First up is peeing. Peeing, as you might have imagined, for a woman is a little bit more logistically challenging than it is for a man. It usually requires, if you don't use anything else at all, it requires removing clothing. It can require squatting in sort of an uncomfortable position, basically, so you're not actually like soiling yourself while you're doing this. This can be a problem. Some people are really concerned about modesty for legitimate reasons. Some women are not, but many of us are, and so that can make it a little more challenging to use the restroom out in the wild. And this can lead women to do things like avoiding going to the bathroom. So they may decrease their fluid intake. They may hold their bladder, which leads to like UTIs and incontinence and things like that. So peeing is kind of a legitimate, it's something we really need to be able to do effectively and comfortably in the wild. So let's talk about some ways that you can actually make this happen. There are some strategies for doing this. Like I said, the sort of standard way is to really just sort of drop trow, squat down, and try to move your clothes out of the way and pee. But that can be really uncomfortable if your knees aren't quite ready to allow that. So this little girl on the left is Christanne's daughter. She's getting a little assist, I think, from Papa to go to the bathroom. I thought it was a great representation of what we can actually do as an adult, except usually not with another person. If you can find a tree, like a small diameter tree, and wrap your arms around it, you can kind of lean back. And that is oftentimes will take a little bit of stress off your knees and still allow you to pee. Another option is to back up against that tree, do a little bit of a wall sit in that sort of a setting. That'll also kind of, you don't have to squat quite so deeply, and you can oftentimes avoid things. I put the picture of the boulder here too. If you have a big enough rock, that works pretty well for that. My personal favorite technique, if it's available to me, is to find a log like there is on that far right side. And I use that like a seat. Sit down, scoot back basically so that your business end is out over the edge of the log. And then you just kind of sit there and be a little more comfortable, take your time. If there's like a lot of rotting material there, it's usually pretty easy to dig a cat hole and get down and bury your waste effectively, which is a whole nother talk. But that's, those are some basic strategies that don't require any sort of additional equipment. Some women turn to clothing adaptations to help sort of facilitate this sort of stuff as well. And one of the more popular ones is actually hiking in a skirt or in a dress. These are great because they're easy to find. People know how they work. A lot of women like the way that you get airflow up there. It kind of makes them feel a little bit less, especially if you're prone to like vaginitis and things like that. You get a little bit of extra, like I said, ventilation going on there. Depending on the cut of the skirt, if you do squat and use the restroom, you've got kind of a built-in tent, so you get a little bit of modesty. The downside of these things is that they're not very protective against the elements. So mosquitoes, sun, poison oak, poison ivy. If you're going to run up against these things, skirts may not be the best option. They're a little bit colder so if the temperatures are a little too cold, they may not work so well. They're also not very compatible if you're wearing like a climbing harness or something like that. So, but something to consider, particularly if you live in a nicer climate. Another step that some companies have taken is actually designing clothing that actually allows you to access the crotch area a little bit more discreetly. So there's this one on the left has a zipper that you can unzip, spread, and do your business. The one on the right is more stretchy fabric. It literally has overlying layers of fabric that you pull aside, and you can use that to squat. You might be able to make this yourself if you have the skills. Otherwise, a little bit more expensive, a little harder to get a hold of, but these are available. These, for women that use these, there are some fans of these devices. This is what's called a female urinary diversion device, or a FUD. It's also been called a pee funnel. My favorite name for this is called a sheenus. I thought that was hilarious. Anyhow, what it is exactly what it looks like. It's something that you take, you can unzip your pants without having to pull them all the way down, kind of pull your underwear aside and stick it in your crotch, and it collects, and then go ahead and urinate, and it funnels all of the urine down and out and away from you, so that at the end you're peeing much like a man would. Women like this, not only for like hiking and backpacking. A lot of women swear by them in dirty restrooms. You're stuck in a car or stuck in a tent in the middle of the night, and you don't really have access to the outside, or you just don't want to go outside. Women will use these to pee into a bottle and then just deal with it later, so they don't have to worry about it. It's like, as the woman sort of on the right I was using to demonstrate, much like dudes, like it's not always obvious that you're peeing too. I can't tell you how many guys I've looked at a guy and I've been like, oh, look at him admiring the sunset. Oh, he's not admiring the sunset. And you kind of discreetly turn your way. It allows women to do that as well when they're urinating. I should also mention that some women have mastered peeing like a boy. There is a bit of a technique to it, and we recommend practicing in the shower before you try this sort of out in the wilderness. But by just remaining standing, tilting your hips forward, using your fingers to spread your labia a little bit out to the side and urinating, many women have been able to efficiently urinate without having to use any extra tools at all. So that might be something you want to consider practicing. I wanted to mention, from a hygiene perspective, the concept of a pee cloth. These have been more and more popular over the years, and actually were what drove a lot of some of the research that the research that I'm doing. Pee cloths can be sort of really basic, like this bandana on the right, or you can actually buy them on the left that are, presumably, that supposedly have sort of antimicrobial properties and things like that to them. And what the idea is that just for peeing, not for pooping, when you go out in the wild, you can use this to wipe after you urinate instead of toilet paper. And the advantages are you don't have to carry a ton of toilet paper into the woods. You don't actually have to pack it out as well. Bearing toilet paper, while still acceptable in some places or allowed in some places, is increasingly not really consistent with leave no trace ethics out in the wilderness, and so people are getting away from that. This is also really durable. If it gets wet, it still works, as opposed to toilet paper. And people swear by them. What they'll do is they'll use it, they'll strap it on their backpacks, and supposedly the UV radiation kind of helps sanitize it a little bit. Again, it's urine, so it shouldn't be as bacterial laden as pooping, which is, again, we don't use it for pooping. That said, from a safety perspective, there's not really a lot of data on it one way or the other. Just know that it's a really popular option right now. I will mention that some women go into the wilderness knowing that they're prone to UTIs, and being in the wilderness can make them more prone to UTIs because they're not drinking as much, they're not peeing as much, their hygiene may be a little bit off. People who are going in the wilderness are on vacation, and so they may be having more sex, which also is a precursor to UTI. So women who go out may want to consider having some sort of prophylactic antibiotic with them, talking with their doctors about that. And then in general, we do encourage people to get really comfortable peeing in the woods, and being sure to drink and pee frequently to try to prevent these types of infections. Oh, one last thing about peeing. Incontinence, super common. Millions of women in the United States have this. And there's some things that you can do before you go in the wilderness to try to manage this. Everybody knows about Kegels. In certain cases, like urge incontinence, medications can be helpful. There's surgical interventions if you're really struggling with it. But for women who don't have a tremendous amount, maybe fairly mild levels of incontinence, they might be helped by reusable liners that you can use, or they now have what they call pee-proof undies that have a built-in absorbent layer in the crotch. And you can use those to kind of absorb some of that moisture if that's an issue. The big issue with sort of the reusable liners and the pee-proof undies is that they typically want to be washed and dried. And in some places, depending on how humid it is and what the temperature is, you may not get that sucker to dry out by the time you need it again. So just something to consider, and always practice before you go out and do it for real in the wild. All right, part 4, pooping. Like I said, it's like peeing, but a little bit different. The squat techniques that we talked about in peeing are very much the same, and so are the clothing adaptations. The big differences here with peeing and pooping really has to do with the time to completion. Sometimes when you're pooping, you're hanging out a little bit longer, and that does make some of the strategies for getting in the right position a little bit more challenging. So got to think a little bit, plan ahead. I look for logs if I need them, before I need them, ideally. And probably the bigger issue with pooping is that it's hygienically, it needs a little bit more TLC than peeing does. One of the tools that's really been quite popular in the backpacking community these days are what are called portable bidets. You can make one of these yourself. You can take a sports bottle and poke some holes in the cap and squeeze it to get it to stream out water. On the slide, these are a couple of commercial things that are available. The left one is just a special cap that you can buy that you can insert on a number of different types of bottles and use, and it redirects the flow of the water that's coming out. The one on the right is obviously sort of a dedicated actual sort of bidet. But the idea is that you poop or pee in the wilderness, and then you can use this to essentially rinse the area. There are some people that this is all they need. They feel like they can get pretty clean with this and move on. Many people will use this kind of as a pre-rinse before they use toilet paper. But it is a really nice sort of leave no trace option for a lot of people. It doesn't, assuming you have water available to you in sufficient quantities, this can be a nice way to maintain hygiene without having to lean in on the toilet paper too much. I would say with pooping, one thing you'll want to consider is bowel changes. Many people, when they go out, especially for extended trips in the wilderness, will notice that they develop diarrhea, and that might be just because they don't tolerate the food as well. Sometimes these high-fat sort of backpacking meals don't sit well in their stomach. There's certainly waterborne illnesses that can cause diarrhea, that can cause problems. On the flip side, some people find these like sort of high-fat diets really constipating. And so folks, who usually don't have a problem out in the front country are suddenly finding themselves a little stopped up in the back country. So one thing to consider, obviously, we're always stressing making sure that you're drinking from clean water sources, making sure that water has been adequately treated so that you don't end up sick in the wilderness. Hand hygiene, washing your hands before meals, always, it's a good idea in the front country. It's also a good idea in the back country. Some people may consider even bringing fiber supplements along with them as a preventive. It's kind of, psyllium husk is kind of one of the great equalizers. It'll kind of firm you up a little bit if you're a little loose, and it'll kind of loosen you up a little bit if you're a little too firm. And then in your backcountry medical kit, you might want to consider some specific medications in case this comes up. I know I tend to travel with bismuth, with Pepto-Bismol, just in case I need to slow some things down. Depending on where you're going, if you're going someplace really a little more exotic, or you're going to be a long ways from help, and you are sort of comfortable making these sorts of decisions, something like some antibiotics or loperamide, which is Imodium, can sometimes be helpful in diarrhea situations. That said, depending on what organism you run into, sometimes these things can actually cause more problems than they help, since most bacteria kind of runs its course on its own, even if you don't do anything. So I would just say use those with caution and with consulting somebody who knows what they're doing when it comes to prescribing those. Another thing, I know some people will actually bring polyethylene glycol, which is Miralax, just to help in case constipation rears its ugly head too. Okay, finally, last one I'm going to talk about is periods. Anecdotally, I think this is probably by far the most common question I've seen on the woman-specific backcountry forums. How am I going to manage this? There's sort of it's really complicated. Or it can be complicated from a hygiene perspective. For those, we try to adhere to leave no trace policies. So leaving our hygiene products in the wilderness is kind of a big no-no. So how do you manage this when this happens? And one of the challenges with periods that I think a lot of women don't anticipate is that being in the woods can be stressful to women's bodies. There's exertion, there's hydration changes, and it's fairly common for women to report that their menstrual cycles change while they're in the wilderness. And so women who maybe haven't had a period for a long period of time, thanks to the use of hormones, suddenly find that their hormones aren't covering it that well anymore, and now they're getting their period when exactly at the time when they were hoping that they wouldn't. So we'll talk a little bit about how this could how you can kind of manage this if this comes up. First off, by far I think the most common thing that women have used in the past is oral contraception. They would just skip their placebo pills and just keep taking hormones so that they could skip periods and basically try to time your period at a time that's convenient to you. You can do this with those vaginal rings, so like NuvaRing as well. You can leave one of those in. Usually you leave it in for 3 weeks, take it out for 1, and then reinsert. You can actually leave that in for 3, 4, maybe 5 weeks, and then swap it right out with a new one and potentially extend your period-free sort of time. The progesterone impregnated IUDs have also become really popular because they tend to suppress either, maybe not always completely, but at least, minimize the volume of people's periods. So there's a lot of options out there to kind of get some of this a little bit under the control. What we do, though, recommend is that you go at least 3 months before your planned adventure and try this out, because every woman is different and your mileage may vary. And we want to make sure if something's not working for you in the first month or two, you've got some time to come up with a plan B. And no matter what you're using, no matter how well it seems like it's working for you, I would strongly suggest having some sort of backup plan for how you're going to deal with bleeding. Because even if you don't think it's going to happen, if it does happen, it can be challenging to deal with it on the trail until you can get back where you have sort of, your usual products to deal with that. So some things that you might want to consider bringing with you are, for starters, tampons, which I think everybody is most familiar with. These have been around for a long time. Unlike pads, which can kind of absorb moisture and get kind of soggy, and a lot of women find uncomfortable, but is a perfectly acceptable option. Tampons, since they insert internally, are a little bit more comfortable for a lot of people. The challenge is these do not biodegrade at all. We do not bury these in the backcountry. They really do need to be brought out if you're out in the woods. And so a lot of women will have a designated bottle that they'll use for these, or they'll take a Ziploc bag and they'll duct tape the outside of it, both to reinforce it, but also to opacify it so you can't see what's inside, and then just dump any sort of like tampon waste in there and then pack it out. That, depending on the length of your trip and depending on the sort of how heavy your flow is, can be a lot of stuff to carry in and out of the backcountry. So a lot of women do turn to these menstrual cups and menstrual discs. There are a ton of different brands and varieties of these, which is nice because it gives women an opportunity to find one that really fits them and works well. But the idea is they're all really kind of flexible and squishy, and you squeeze them and you insert them, and they open up, kind of wrap around your cervix so that you're essentially bleeding into this cup and collecting it rather than absorbing it. And then when you're ready to change it out, or rather to clean it out, you insert a finger, you remove it. Usually have to like kind of break a little seal, take it out, dump out the menstrual fluids in your little cat hole, clean it out with clean water, and then you can reinsert it. Other options that maybe aren't quite as popular but are definitely out there. Some women still use menstrual sponges. You can still find those that will absorb, and those can be reused. So you absorb the fluid, take it out, rinse it out, and then reinsert. And just like with the incontinence, we were talking about reusable cloth pads and reusable underwear. They make the same thing for periods as well. And as long as you're able to wash and dry and get that taken care of in a suitable amount of time, they work really well. That said, even if tampons aren't like your go-to menstrual product, you'll find that a lot of people carry these Men Too in their medical kits because you can use them for a lot of things. This gentleman on the left is demonstrating. We use them a lot for nosebleeds because just, you know, they're nicely sized and absorbent and expand and can really help with nosebleeds. You can open them up and make them into a bandage. You can use them as fire starter. This person on the right is using it as a water filter. I would just say might be really nice for like sediments. So if you have a really, what you know is really pretty clean water, except there's like particles in there, that might be fine. I would not be relying on my tampon filter to keep out bacteria and viruses though. And last but not least, we get this question comes up all the time, but what about bears? When I have my period, do I have to worry about them bears being attracted by my menstrual flow? And the answer is no. That one has been shown to be a myth. So feel free to go out. Don't worry about bears creeping around your tent because you're on your period.
All right, so I'll take over with passion. I'll say I have the procreation piece now to talk about. So the next one is passion, and similarly, it's kind of the same as in the front country. So basically, the hygiene considerations that you're going to think about are similar to what Kelly's already shared with you, because we're not getting into the details of where and how to do it. I will say, unlike this photo here, make sure you're not backlit or you have like your headlamps or something on. But kind of how do we keep ourselves clean and comfortable throughout the rest of the night after we're done with our passionate episode? So the menstrual cups that were just mentioned can come in very handy afterwards if you want to insert that after intercourse. That'll keep your bag and the tent from getting messy. Or you could also lean on your backcountry bidet for a more thorough cleaning if that's an option for you. But let's just take a quick minute to talk about vaginitis before we transition into the after effects of passion, which can be pregnancy. So with vaginitis, we've talked about someone so far, but definitely vaginitis, STDs, and even sometimes consideration of pregnancy prevention for you potentially personally, but also if you're going to be an expedition medical leader on a trip, because being in the outdoors and sometimes on very prolonged trips means that people can find other ways to entertain themselves. So probably it's best for you to carry condoms for yourself or potentially for others, if that's something you find yourself engaging in, and also making sure that you have options available to treat vaginitis. And it may not be because of intercourse, but it could just be simply, again, because of all those changes of being in a wet environment, of not having your typical hygiene, of using different types of soaps or wet wipes that can get in the way too. So remember to bring the medications that you'll need for that. Fluconazole in general for yeast infection, and then remembering that there's bacterial vaginosis and trichomonas, which can be treated with metronidazole. And for even individuals that have other sexually related infections like HSV, perhaps if it's someone, you could encourage them to bring their medications with them because they may have an outbreak and that can make their trip somewhat uncomfortable. If you are really going to be on a long trip, you might also want to consider bringing empiric sexually transmitted infection medications that are available. And there are oral options without the need of bringing IM. And just for time's sake, I won't get into the details there, but happy to share more with you later if you'd like to discuss that. And then lastly, I have the urine pregnancy test on here. It's always important to carry with you in your medical backpack, but certainly whenever you get into any signs or symptoms of a particular person, you want to make sure if they're pregnant or not, because that can change your approach and also the potential need for evacuation. So let's just cruise into pregnancy, which is the next topic here. And I'll kind of start off with just a really quick overview of pre-trip planning. Then we'll talk about general rules to follow, and then we'll get into some specific activities. But there's a whole lot to talk about here. And again, this is an area of interest of mine, so I'll try not to be too long-winded. But before you go on a trip, how are you going to prepare and what are you going to take with you? Ideally, if you're trying to get pregnant or perhaps don't have regular birth control use, you probably should consider performing a urine pregnancy test beforehand. And if someone is pregnant, really encouraging them to get a confirmatory ultrasound to know if that pregnancy is viable and if it's in the right place. Other things to think about that you may not have considered before is even your blood type. Because if you're Rh negative, then again, that could change your trip based on any problems form down the road. There's a lot of different vaccinations out there. In general, they're all safe. In addition to your COVID vaccine and flu vaccine, you probably are going to have to consider the areas you're traveling to and if there's specific vaccinations. One of the vaccines that has traditionally been controversial, the yellow fever vaccine, because it's a live attenuated vaccine. Again, there's still some studies that support it, some others that don't. So in general, considering avoiding travel in those areas if possible, or talking to a travel provider if you need to consider that more. And then many of you may be thinking about the different types of mosquito-borne illnesses. So particularly Zika can be problematic. And short of mosquito avoidance techniques, really trying to prevent the contraction of that infection and potential downstream effects to future offspring should try to be avoided. But there's other things to consider too. Is okay, if you're going to a malaria-prone area, then make sure you're taking the appropriate medications. Again, considerations of dengue and chikungunya that may be around. So those are just some things to consider if you or someone is pregnant and going to be traveling a certain area, to make sure you talk with your provider and prepare for it before you take off. But let's talk a little bit more about physical activity. So there's a lot of benefits. Exercise in pregnancy, it's great in decreasing rates of gestational diabetes, decreasing frequency of C-sections and operative vaginal deliveries, and improves postpartum recovery. So how do we talk about specific physical restrictions when there's a lot of things that we do in the outdoor that you may find people telling you is too risky or is not a problem at all? In general, I will say the one overarching thing is to make sure that you're keeping people hydrated. And that's because there's a lot of things that come into that. It might be the environment. If you're in a very cold environment, high altitudes, desert, all of those can potentially lead to dehydration. And that's in addition to the normal nausea and vomiting of pregnancy. So really staying on top of your hydration is key, not only in the front country, but also in the back country. So some rules to kind of live by are what the American College of Obstetrics and Gynecology recommends. So if you're going to go out and exercise in general, if it's an otherwise healthy individual in pregnancy, trying to keep your heart rate below the 140. So this is not the time to go for your target heart rate, but also knowing that you can exercise 30 minutes an hour, but trying to keep those really strenuous activity less than 15 minutes and trying to maintain a normal core temperature. The other specifics, they say, no supine exercise, so don't lie on your back, is recommended after 4 months. And if you can't remember all these other specifics, just remember the talk test. So that means that if you are exercising and you can continue to carry on a conversation while you're exercising, that's probably safe. If you're so out of breath that you can't continue speaking in a continuous sentence, then maybe you need to slow down a little bit. But in general, activities can be safe. But let's get into some of these that fall under this last clause of activities with high risk of falling or for abdominal trauma that should be avoided during pregnancy. Because if you take that clause, then you may say that you're out of luck for any activities. And I'll start with altitude and mountain travel. Again, there's not a lot of studies out there on pregnant individuals, so we have to take retrospective data or questionnaires in the past to give us a bit of an idea of what's safe and what may not be safe. But in general, anything below 3,000 meters, which is roughly under 10,000 feet, is considered safe for outdoor travel. And some surveys show that even at higher altitudes are safe too. But the main thing we always want to emphasize is to make sure you're having a staged descent, meaning you're taking more time to increase your elevation slowly and ideally over several days. So take some more time than you typically would in increasing your elevation. Acetazolamide is a common medication that we may use for people and that want to acclimatize quicker, but there are some potential congenital issues. So, in general, try to avoid the acetazolamide if pregnant and just focus on that staged ascent. And as far as skiing and snowboarding goes, again, people are going to have varying levels of comfort. I know for me, I snowboarded up to 13 weeks because the baby I felt was inside the pelvis. And after that, I had more concern about individuals around me that I couldn't control running into me versus my own safety. But again, there are plenty of women that continued skiing to the end of their pregnancy and didn't have a problem. So there's not a lot of data out there, but it can be safe. And I will note there's some photos on here of some of our other wilderness medicine colleagues during their pregnancies that they shared with us for these presentations. So the next subject is on climbing. And I'll just bring up a bit here, that rock climbing is a lot of fun. People enjoy it. And so how do you continue enjoying that activity throughout your pregnancy? So there's a fair amount of concern about this ligamentous laxity that occurs during pregnancy. As the ligaments get more lax, we have more hypermobile joints, and ultimately, does that really lead to increase in injury? And thus far, there hasn't been any data that really proves this increased risk, but it's something to consider when moving forward. And perhaps even more importantly, might be the weight change. And it's more so that a more rapid weight change than one would typically have when they're pregnant, and considering how that might affect increasing risk of finger tendon injuries or strains while climbing. But there is equipment that's specific for women during pregnancy and also for young children with a full body harness that can be used. Typically recommend for people to start using that full body harness as they enter into the second trimester. It's safe. It takes any pressure off of that growing belly and can keep women out there climbing and having fun. So the next subject is running. And with that, what is addressed in some of the ACOG guidelines is talking about jogging. But where do you distinguish jogging versus running, and what's really safe or not? And again, many people have varying opinions about what is or isn't safe, and when do you have to stop running if you were running before. Again, I would say that in general, if you can still complete your talk test of talking while running, then it's probably safe. There are plenty of women that already have a high level of activities, and they may have already been performing endurance races and involved in them. So again, if you're already participating in the sport pre-pregnancy, then it's probably safe to continue. Certainly not the time to pick up marathoning. This photo that I have here, I will point out, is Erin Drasler, she's a rock star, and this is a picture of her 20 weeks doing the Leadville Iron Woman series, which is a super long endurance event and a very high elevation. So you can do it, and you can do it successfully if it's something, again, that you're typically training for. And there's even now specific clauses referring to elite athlete women that become pregnant, and essentially statements from the American College of Obstetrics and Gynecology that say it's safe as long as you to continue that exercise with close monitoring. The one thing of interest to you all might be your shoes. As far as any equipment goes, shoes are really important when you're running or walking. Women's feet tend to increase in size during pregnancy, and it may or may not go back to normal after pregnancy. So make sure you're testing out those shoes beforehand so you don't develop blisters, and you may have to adjust them as you move along. And then kind of moving along from jogging and running is now hiking, or I have hill walking. That was one of my favorite terms for it that I learned from some British friends, hill walking. So what do we think about when we now talk about hiking for many miles or multiple days in a row when we're backpacking? Again, those shoes are really important. So make sure you have proper fitting shoes because you don't want to get blisters. As the pregnancy progresses, there's more pelvic girdle instability, and that weight gain may mean your center of balance changes. So perhaps now is a time to use your trekking poles more frequently and be more cautious of knee injuries and other potential discomforts that you might have. Additionally, with backpacking, folks ask, well, how long can I continue backpacking? We got a picture here of Kelly at 18 weeks. The latest I went backpacking was 11 weeks with some of our med students in a course. But in general, the thought is like up to 20 weeks, you're probably safe. And then there's this unofficial rule, probably after 20 weeks, it's not safe. And that's more so because if conditions or problems arise when you're in the backcountry, then it may take longer for you to get evacuated and get to a medical center to have care. Most of the time, women don't want to consider backpacking past that point just because you can't wear a backpack normally and you can't use that waist strap to offset the weight off of your shoulders, so it can become more uncomfortable. But for those individuals that really love backpacking, they can make some modifications, make your pack lighter, not make it too tall. There's even some cool packs out there that's not a regular backpack, but you can actually have packs on either side of you to carry your items. It's called a back T pack that's out there. But in general, thinking of how to distribute that weight, because as you have so essentially a pregnant belly is like a front pack, and then you're carrying a front pack and a backpack. So think about that. And then the last subject that I, within this portion with backpacking, is just your nutrition. And I know for me, that was a big consideration at 11 weeks. I was just coming out of that nausea and vomiting pregnancy. And oh my gosh, am I going to be able to keep down the dehydrated food or the food that I'm supposed to be eating? And particularly, am I going to be able to maintain hydration to keep me safe during that time? So those are all things to consider too. Oop, and I realize we're running along a lot, so let me just speed through these last slides. So water-based exercise. This is something, again, that is pretty common here in San Diego. So we know that water-based exercise, including lap swimming and water aerobics, there is data out there to say that it's very safe during pregnancy and can be a great form of exercise. There's also open water swimming can be safe, and maybe women might have to consider if they're prone to being seasick, if that's going to work for them or not. Here we've got an individual that's out kayaking, and in general that's safe. Maybe you don't want to be, whitewater kayaking because there's more opportunities for injury during that time. And then even surfing can be continued late into pregnancy with considering the modifications as far as it's harder to pop up onto the board as you get further along. You can't really paddle out easily. Maybe you need to modify on your knees. And another interesting thing in pregnancy, GERD is more common. And then surfing is also another activity that increases your risk of GERD. So you might get a double doozy if you're really loving and continuing to surf during that time while pregnant. Other water-specific activities that might be of concern and you might want to take pause with. The first one is scuba diving. So we can't do research on humans. We know there's animal data out there that says that it's not safe. Anecdotally, women that have found out they're pregnant after they've been diving haven't had any adverse effects, but the general rule is just to try to avoid it for 9 months during that time because we just don't know the risk. Other sports, water sports that might be risky are water skiing and boarding, or even using jet skis. And that's because of the impact of landing with water getting flushed into the vagina, whether it's falling while you're skiing or being on a jet ski and that water getting propulsed inside, which sounds really uncomfortable and has caused very significant injuries in patients, but particularly during pregnancy, that can lead to devastating effects to that pregnancy. Hot tubs, there's always signs up about that, and it really is important to avoid those high ambient temperatures because hypothermia causes increased risk of problems throughout all stages of pregnancy. So just avoid it. And then lastly, for individuals with cerclage in general, it's no ocean, and in most cases, no pools either if a patient has a cerclage. So what is a sport or an activity that is considered safe is yoga. I know I really enjoyed that, and that was a great activity I could continue doing with my daughter during my second pregnancy. It helps with your breathing. Consideration is if you're one of those hot yoga people, probably during pregnancy is not the time to do it. Make sure you stay well hydrated and that you're in a well-ventilated area. And there are some modifications to think about with your different types of poses and positions that you do. So we mentioned earlier, after 4 months, you shouldn't be laying flat on your back. Additionally, it's probably going to be hard for you to do a lot of forward movements and other activities too. Deep side crosses and holding those for a period of time sometimes might be uncomfortable, but they also compress the belly, so you might want to limit those. But you don't have to worry about missing out for Shavasana. Of course, you're not going to lay flat on your back, but you can at least lay on your side to still have that benefit at the end of your session. So lastly, higher risk pregnancies. A lot of these things I've been mentioning are all under the contingency that this is an otherwise healthy patient with an otherwise uncomplicated pregnancy. Continuing to do these activities with understanding the risks and benefits is fine. but take pause or maybe consider make some considerations even further if this is a pregnancy with more than one baby, if you have a history of preeclampsia, a placenta previa that's persisting into that third trimester. Obviously, if they have a history of premature membrane rupture or again, a cerclage, are all things to consider. And if you're out enjoying yourself and whatever activity you're doing and these things pop up, you probably are going to stop what you're doing. But again, vaginal bleeding, belly pain, if you have amniotic fluid that's leaking, you're probably going to quit what you're doing and head to the hospital. Increasing with shortness of breath, with dizziness, headaches, or other concerning signs really should mean that you should seek medical evaluation. So pumping, I'll just talk a really quick bit about this. It's an unavoidable reality, and many of you mentioned, pumping or breastfeeding was led to you avoiding outdoor activities. It's hard. It's hard even despite our modern technologies with creams and gadgets and lactation consultants and too many blogs to confuse you about what to do and what to do. And oftentimes, even in women, whether they're purely breastfeeding, they're purely pumping, or a hybrid of both, you're going to have to find ways to modify, whether it's returning to work, it's traveling without your baby, it's sleep, it's surgeries that you weren't anticipating, and so you can't be there with your child. Like this crazy patient here that allowed me to take a picture of them and share it with you all. So what are some things that you can then look at or turn to help you? Well, I just wanted to share this picture with you of this very inspirational lady, Jasmine Paris, who this is with her 14-month-old child, Rowan, who completed the Montaigne Ultramarathon, which is over 250 miles. There's no time. It's just like who can get it done as quickly, so you can decide if or when you sleep. And so she completed this run with her partner meeting her at every checkpoint so she could express milk for her child, continued on, and she didn't just complete it, but she won the whole thing, and she beat the record by 12 hours. So she was a rock star. And got very creative on how to make sure that she was still able to provide milk for her child. But there's a lot of other things out there. There's newer wearable pumps that I'm not even familiar with now since my last pregnancy, which can be great. The hands-free bras that many of you are probably familiar with can help you to be more discreet. A lot of the new machines are quieter and have wilderness medicine colleagues that have been out and put in their willows, or they're out skiing to pump and then bring the milk back to their child later in the day. Thankfully, there's plenty of pumps out there now that you don't require you plugging anymore, that actually have batteries that can adapt, or you can actually plug into your car, which is what I used when I was out camping without my babies. And there's great storage systems now, not only to like keep things cool for a period of time before you can get it back into a cooler or in a refrigerator. Other few things I'll mention is when you're out and you're traveling is there's a lot of really great lactation location apps like the Mamava apps. You may see in those little pods in different airports that are available for either breastfeeding or pumping. And then there's a lot of different wipes. If you don't want to go and buy fancy Medela wipes, you can just use regular hygiene wipes. It's going to help you keep your pumping gear cleaner and reuse it for longer periods of time. And if you don't have any of those gadgets, or you just don't have the space, you can use a handheld pump. Those were the original ones to use, or even just hand expressing milk if needed. So that was me rushing through those last things because I know now you're all pumped to get out there, but please share with us your strategies and your challenges in the past, and we'll take any questions you might have.
Awesome. That was so great. Thank you, ladies. And if anybody has any questions, please feel free to put them in the general or put them in the Q&A section, and I will float those over to Christanne and Kelly. We don't have any yet, but I think it's just because, that was such a wealth of knowledge and we're all just here for it all. We're just all taking it in for a second. Someone said thanks, though. Thanks for the great tips. So love that. Yeah, people are just saying that they loved it. So I don't know if anyone has any questions. Oh, we got one. Hey. Any advice on training to use the Shanice? Sorry, guys.
The Sheenus. Yeah, the little pee funnels. Only honestly, probably your shower is your best friend. If you're really uncomfortable trying to use it in the first place, a lot of women will practice peeing is in the shower. And what's nice about that one is, yeah, you can do it standing up and do that. Other than that, yeah, it's more, I'll be honest, I haven't used one a ton. I got gifted one, but it wasn't as nice as maybe the ones that I demonstrated, and I never quite could wrap my head around it. But it's going to be on my to bring with me list this year, because I think I'm sold. I think it's throw it in my wildland firefighting pack, because nothing's worse than squatting in poison oak.
Yeah, with my experience with it is the ones that I have is like, if you got to really cup it up in there. Like if you don't make a good seal, then that's when it gets messy and it leaks out. So like Kelly said, practice it in the shower, because then if it's messy, you can just clean it right up. But you got to make a good seal.
Perfect. All right, you guys get out there and use those. Let us know. We'll report back. Can you talk a little bit more about good feminine hygiene regimen for longer trips?
Yeah, it's a good question. It's funny. As much as we talk about what good feminine hygiene looks like, I don't know that there's a lot of it's shockingly not as evidence-based as you'd think. That said, I think, again, what we do for ourselves in the front country, we should try to mimic it as best as we can in the back country. So a lot of women will, so like the bidets, I think for a lot of women are really helpful, because you can kind of essentially like rinse after everything, whether it's menstruating, whether it's peeing, whether it's pooping. That first rinse kind of makes it a little easier to clean afterwards, whether that's with a pee cloth or with some toilet paper. Some women bring wet wipes. There's actually, I didn't mention it in the talk, but a lot of women will take wet wipes, allow them to dry out, and then reconstitute them, add some water in, and use those both sort of in the genital region, but also all over at night, which a lot of women swear by. My only word of caution there is that some people are sensitive to the ingredients in those things. I've seen cases of dermatitis from wet wipes before. So, again, sort of practice what you do before you go out there and make sure it's okay. I worry a little bit, and again, this is more anecdotal than evidence-based, that wet wipes might change the pH a little bit vaginally and might lead to a little bit more vaginitis. That said, women swear by them, because it's a pretty easy thing to bring, reconstitute, get wet, and feel a little fresh and clean, more so than just wiping. I don't know if Christanne, if you have anything else to add.
Yeah, I think wet wipes are that we can't bury. Those can get buried with the regular toilet paper. So if you're going to take them with you, you got to pack them out.
Yeah.
Any other questions? I'll give it another minute or so.
I'm sure there's another fun tip or trick out there that we didn't talk about that someone wants to share.
Do you have any advice specifically for girls from diapers to preteens?
For girls from diapers to, as far as diapers go, yeah, I mean, plenty of parents will take their kids out with diapers, and you can either pack it in or out, or may use cloth diapers if you have access to fresh water to clean them. Like there's a couple that took their child under 1 year, and they did the whole Appalachian Trail, and the mom just breastfed the baby the whole time, and they had cloth diapers, so they'd clean them and they'd put them on top of their pack to dry out, and then reuse them over and over again. So you can get creative with that. In preteens, I don't know specifically what they're asking for that. But I do know for teenagers, or even just women in general, the period underwear is great. And so some women, especially if they don't have very heavy periods, will forgo worrying about the tampons or the menstrual cups and just wear the period underwear. And I think it's helpful.
I remember reading one woman say that's why bicycling shorts are black. It's because that was their choice. And in a cycling perspective, they just went without, because like, it's black, no one will see.
Mm, thank you for that. Worth reminding ourselves and those we work with that not all who have vaginas can use tampons or know how to use them. I love that, and we appreciate that. I'm gonna heart that because it deserves that.
Very true. And definitely the menstrual cup is something that is not going to be something that a lot of people would want to use.
Dinner time. But yeah, if there are no more questions, I'll give it another minute, but I'll kind of wrap up while we're waiting for any more questions that we have. I just want to thank everyone so much for coming again, and thank you, Kelly and Christanne, for being such great hosts. I think that it was just such a great information that we can just take out into the wild with us. And I know that I'm now ready to go adventure. So I know that we're all excited for that. If there are any remaining questions that you forget to ask or anything like that, I will be sending a wrap up email with the recording shortly after this wraps. And if it's not tonight, it'll be tomorrow for sure. But it will have the recording and the slides included. So don't fret, I will get it to you. If you have any other questions, you can always feel free to email me back from the platform. I get all of your emails, so don't feel like, anything will go unread. I'll make sure I get it to you. And even if you have any questions for the hosts, I can also lob those to them as well. We will also be sending out a survey. So if you guys could fill that out, this is how we get better and make events, just so much greater for you all. So if you guys could do me a favor and fill that out, that'd be great. But other than that, we just want to thank Wilderness Medical Society again for bringing these wonderful hosts to us. And yeah, be looking out for our next great event. Thank you all for coming tonight, and I hope you guys have a wonderful night.